2021.
1920.
5:32 p.m. Call the meeting to order, and we'll do a round of intros. Janice Desmond, board chair.
Linda Hayes, director of the Senior Center.
Go, Susan.
Susan Kelly, vice chair.
Laurie.
Laurie Brady, board member.
JD.
JD Miller, member.
Janice Lindblom.
Janice Lindblom, board member.
Caitlin.
Caitlin Coyle, board member.
Hey, Caitlin.
Hello.
Pat. You want to intro? Pat Carlton?
She's muted.
She's muted.
Elaine, you want to intro?
Sure, it's Elaine Shimbari, liaison for the trustees.
Joan?
Joan Powers, liaison for South Shore LD Services.
Karen?
Hi, Karen Canfield, liaison to Select Board.
And Pat, can you hear us now?
Yes, I can hear you. And if I can figure out my new laptop, you'll be able to see me in a few minutes. Pat Carlton, board member.
The reveal. We'll see.
Leslie? Okay, we read your lips. And Barbara?
Hi, Barbara, associate member.
Great. Did I get Gordon? Sorry.
Hi, good evening. Gordon Price, Build a Campus in Foss.
All right.
Okay.
Welcome, everyone.
Janet?
So Gordon, you might need to be closer to your microphone, and JD, you were really, really soft too.
Yeah.
Is that better?
A little bit. Yeah.
Janice, I'm wondering if I'm seeing someone down here who's sort of waiting. I wonder if that's Randy, our guest.
Where is Susan? Yeah, Randy.
I'm right here. There's no one in the waiting room that I can see.
Well, keep an eye. I don't have her phone number memorized, but keep an eye out.
Oh, no, the phone number is Pat Carlton.
Okay.
Oh, do I have my phone number on it?
Let me check my email for our guest. Right.
Yeah, so we do have a guest joining us. Susan, I think was on our agenda. Randy Viraguas. So as soon as we see her, we want to let her in.
Sure, absolutely.
I think we can go ahead. And Linda, you want to, well, actually our first thing is our December minutes. Is everyone, if you want to take a few minutes just to quickly go over them, and if you're ready to approve, you can do so.
She's muted, and please.
She's saying her phone does not work.
Phone doesn't work.
So I'm not sure how to help Leslie at this current moment.
I wonder what kind of device she's using. But
Is this Leslie? We did hear her for.
No, I'm sorry. No, that was actually Seth. No, Leslie, she's just writing on a notepad so you all can read what she is saying.
please, Dell laptop. So she can actually, I wonder why her mic, it's a local issue, not a Zoom issue.
Okay. So is Pat Carlton, are we not going to get to see you?
I just called my tech person to see if he can come down and help.
Okay. Well, you're lucky you have one.
He figured it out last
it
night.
works.
Pat, do you need help? I just asked you to start your video. You should be able to. There you go.
Okay.
Very good.
That might be overtime, Pat. That might be an extra, time and a half if you had to get help.
Okay. Are there any comments? Has everyone had a chance to go through our December minutes? Okay, any comments? Susan, I see Randy.
Yes.
Um,
Oh,
okay. Hi, Randy, welcome. You're muted.
Hello.
Okay. Hi, we're just starting our meeting and we'll get to you in just a couple of minutes.
No rush.
nice to see
Fantastic.
you.
Thank
Hi.
you.
Welcome.
Thanks.
Okay, do I have a motion to approve the minutes?
I move to approve the minutes.
Second.
Do I have a second?
I think JD seconded.
Okay, second, great. Move to
Nice
approve.
job on the minutes, Janice.
Yes, Janice Lisbon, thank you very much. These are great. And we have Pat Carlton taking our minutes tonight. Great.
And as everybody knows, it is being recorded, so it is available, or it should be. You should be able to locate it on SCTV
Okay.
if you needed to review it.
To fill
Thank
in. That's right. Thank you. So minutes then for December are approved. And I'm going to turn this over to you, Linda, for Linda's director update.
Okay, all right. All right, well, hi, everybody. Happy New Year.
Hi.
I hope you had a chance at least to look at the report, or if you can't print at home, at least, you had a chance to take a look at it. I don't know if people had received our new newsletter, but I think at our last meeting, I was prepared that it was going to be late into January, but instead everybody had it in their mailbox before the new year, and as soon as we send it in, and they publish it online almost immediately within a day. So it was available, and that is helpful. A new color, a new format, so I think it was good. I am excited about the AARP tax aid program getting launched this winter, spring. So we've already had some response from the brief bit I had put in the newsletter about it. Otherwise, we haven't really publicized it yet. I haven't put it in the paper, but and we decided not to begin the scheduling of meetings for people, the brief initial meeting for people to meet with the volunteer from AARP, because I wasn't sure when they'd be able to get in the building. And even now, as it stands, we'll talk about this later, but even though I have them starting to take appointments on March 2nd, a little, a month into it, we may still have to use the community building. I'm just not certain that I will be all moved in, or that everything will be done, just because of a couple of delays that we know about at this point. So she's fine with that. I'm going to meet her there tomorrow, the woman that's coordinating it. So anyway, I think people are going to be happy that we have it here. It is actually available to any age person. Obviously, there are priorities maybe given to older adults that would be our clients, but actually it is available to any age.
And Linda, when and how are these appointments being scheduled?
Well, we haven't started scheduling them because we did not have the requisite paperwork that we want them to pick up. I will have that tomorrow or next week. So we'll contact the people who have already called to maybe start to schedule them. Jill will take care of scheduling. So once we have our system worked out, we will start to do that.
Okay.
So that's good news. Christmas was, nice. I mean, certainly quiet for us, but we did do a little, grab and go treat for the holiday. I think we prepared 35 plus a few for our instructors as well, which was just a nice thing to do, or to try to do. I did provide a continental breakfast refreshments up at the construction site for the people working for us all this year under some really terrible conditions. So I just felt like a thank you was in order, and they really did appreciate it. So coffee, donuts, coffee cake. We had some freshly made stuff that had been frozen in our freezer. So that was good. I don't know if anybody saw the signs I had printed and put up at the site, just to kind of give a little wave or just some sort of connection for the holiday. So there were 6 signs. And actually, I still have forgotten to take them down. So I think it's time to take them down. But I
think they're great. I think we should leave them up.
Well, I know that must be why they're still there, because I didn't want to take them down too early, but maybe before Saturday's big rainstorm. And then actually, nicely enough, one of our softball board members brought lunch into the staff one day before Christmas, which was very nice. They'd never done that before, but I've been more in touch with them, and they're coming under our umbrella a little bit more for the coming year. So anyway, we're looking forward to that, and that was nice of them. Certainly the building itself, which again, we'll talk about separately, but just been a lot of things coming due, a little bit of a frenzy as the contractors try to complete things, as some of the other subcontracted work still had to be considered. So the AV had to go out to bid, which I think I told people. So anyway, I had a bit to do with that. Budgeting for IT, because we have an FF&E budget of so much money, but out of that money is furnishings, is IT, is audiovisual, so is the kitchen.
I think
smaller
a
equipment.
guest has been admitted into the guest room.
I didn't let them in.
No, Andrew, that's.
I can remove them.
Yeah.
No, that's a public, it's just somebody who's coming to the meeting.
Who said that?
I did.
Oh.
Yeah.
Oh, okay.
Community resident.
Yeah, they can hear.
Yeah.
So what was I thinking? Okay, IT, the cardio equipment. So there's a lot of components there that aren't identified. It's just that you have to divvy up that money. So that's been kind of a consideration as to how much gets to go to each component for the FF&E. So the cardio equipment was approved. I think I might have mentioned that last time we had met. And also the North River Grill at Widow's Walk, the pub there is closing. So she had some things for us to take a look at and maybe take on so that we didn't necessarily have to purchase them. So she has donated, and I will pay for some of the stuff, some pots and pans, some things that were in good shape, honestly. It helped her, it helps us kind of whittle down a little bit of what we have to buy for the kitchen. So I have a bunch of stuff here, and we're inventorying the kitchen. So that's taking some time, really trying to get down to, as much silverware, serveware, cookware. And then lastly, just generally speaking, I know last time I talked about the budget, but so although it's still pending, we are going to, we are requesting the hiring of a part-time kitchen food service manager, and we are planning to develop a food service program that would include congregate dining. I'm really proposing maybe 4 days a week instead of 5. Maybe just to make things a little bit easier, keeping the part-time hours to 18, if that's my estimate at this point. But the Congregational Church always did 1 day a week luncheon, if in fact that can come back. I didn't want to infringe on that, so that had been my thought anyway. So we'll see, 4 or 5 days, plus the cafe window, 5 days a week. What we won't attempt to do right away is to take on the home delivered meals. So we're going to leave that as is, and I think that's a good idea. That was the town manager just deciding let's do one thing at a time,
right?
Which is fine with me. We will also be posting the activities volunteer coordinator position shortly. I'm just working on the job description to update it, and we are posting a new driver position.
Linda, can I just ask a question on that? So is that going to have to be posted on the town website first? Does it have to be posted internally first?
Normally they post internally for a week, yes, before it goes out. That is.
Because I was going to say after that.
I assume it will follow that, yeah.
If you need, I would love to maybe give a 50-plus person a chance to apply. But.
Yeah, it could be popular. Programming, it's met a little hiccup, of course. We were doing some in person, as you know, some of the exercise using the gymnasium, but because of the recent town restrictions for in-person we've suspended. So we were taking a couple of weeks off and then we extended into next week. And hopefully we're bringing them back carefully, safely toward the end of next week. So that is the plan right now. And I'm confident, I guess, that we should be able to do that. The fitness videos on SCTV continue. Bob Jackman has just started another video presentation for 6 weeks. He's been consistent for us. We do have our support groups, all 3 support groups, the grief support group by Susan, the caregiver support group with Suzanne, and the Parkinson's support group, which has been weekly and has had Scituate participation, but they had changed days from when they were originally doing it to an evening now. And the grassroots pickleball, I know Gordon participates in that, and every now and then I get to jump in and play, but I mean, I say that because it's just completely on their own, volunteer led, but they are playing nearly every day if the weather allows, and it's just great, to the point that there's almost no need for the indoor. So we had started that, and we got some interest for the indoor, but not an awful lot. Now it's suspended for the short term, and we'll pick it up again if people want, but the outdoor's been fine. So they're having a blast, I would say, and getting a lot of people. Transportation news. So we got some really nice news last week that we got, and I'm sure I told you about it at the time. But Kathy Clarkson, our previous transportation coordinator, had submitted an application for a grant with Mass DOT, and we got that grant. So that will allow us to actually buy a new van. Our current Council on Aging van, the one you see with the blue letters, we call it the blue van. It's the only one we own. The other 2 are provided by GATRA. So, so it's just in sort of sorry shape, and maintenance was getting to be an issue. So it would effectively replace that one. And but we haven't really decided on the style. I'm just looking to try to do something that we don't have. So maybe make it a smaller van now that we're doing some out of town travel for medical appointments. It just might be nice to have a smaller van in addition to those larger vans that allow us to do the bigger trips. And of course, right now we're not putting an awful lot of people on the van. Presumably that will change toward mid-year or mid to late 2021. So the funds that we received, it's 50,000 and some change. And that also requires a matching amount from us of 13,000 and some change. But you might remember last January, I think we got a very generous donation from a trust from someone in Scituate that was being managed by someone else. But so we have that to use. So we earmarked it for transportation, and that's what's available for the $13,000 match.
Great.
So otherwise, Ann did a report for us, Ann Gifford, who's our new transportation coordinator, and she's getting acclimated and doing very well with that. But so we have consistently, I guess, 26 riders, not as many going to the supermarket.
JD has a question.
How much does the van cost?
Sorry, you're so soft.
How much does the van cost?
Well, that remains to be seen, whether it would be a new van or whether we would look at a used, year van, maybe the one that was used as a lease van. But I really don't know yet, JD. I don't. I just got it and I didn't look into it. Ann's looking into that a little bit for me. And I wanted her to call Hingham. They've always bought their own vehicles for that. They've not used a regional transit authority like the ride. So anyway, we're just doing our research now.
So just out of curiosity, if a new van costs $50,000 and we've gotten a $53,000 grant, we don't have to match anything, do we?
I didn't hear the end of that.
If the van costs $50,000 and we have a $53,000 grant,
right?
We're covered.
Well, I mean, that's the amount that they awarded us if we don't need it. I mean, I assume we don't take it all, but I think it might be more money than that, the van.
Okay.
I'm guessing it's 60-ish, but I don't know.
Okay.
I am too.
Again, it's a little bit of a guess, but maybe I was told that at one time. So we'll see. Yeah, I don't know. And in fact, you know what? They gave us the announcement for the award grant, but they said I will get more details in a couple of weeks. So I don't actually have all of the detailed information.
Okay.
And we couldn't really research it until we knew if we had the money. So that's where we're at. So 26 riders, fairly consistent on travel, but actually we've been in a bind because we only have the one driver. So we have had to use South Shore Community Action Council still a little bit more for some of our medical out of town, even though generally Joe was doing it and Joe likes doing it. He likes to keep busy. He'd work 5 days a week if he could, but he can't be in two places at the same time. So we can't have him in Plymouth for a medical and going to the supermarket. So that's been an issue. Mary Brown is out for a couple of months. So that's why we're, our hands are a little tied. But again, there's been no suspension of transportation since COVID started. So we have been doing it. We've been meeting the needs. We haven't said no. Outreach as well. I think the numbers are up there. This being for December, but you have Jenny's report or received Jenny's report as well. 99 interactions, which of course take different forms or in different categories for her. But that's 52 people that she has taken care of. Now, for the most part, she has kept the meetings virtual. She has had to do some home visits, which generally have been outside. We did have a sad case of someone that we do monitor and take care of. And we were called because people hadn't heard from her. And unfortunately, she was found to be deceased. And Jenny was the one to discover that. So that was kind of hard. But for the most part, she's been able to meet with people if here, outside, or, you know, we do allow 1 or 2 people into the center at the same time because we have the room in the big room for that. So Shine, you know, we ended up, I forget what the total number was for open enrollment, but it's been ongoing. And Rich has a 1 appointment a week by phone, and Elaine has filled in with at least 2 or 3 in a month's time, and we'll continue to use her as we move forward. So we are looking at how to do outreach as this continues, of course, our inability to see our seniors. So we are looking at contacting people without emails because it's been a lot easier to keep in touch with those with email, with the constant contact messages I try to send out weekly or bi-weekly. And those people who might be participating. And on the last page of my report, I did put together a list. I didn't really include the exercise, which, you know, we have been continuing to do, but all the other types of activities or programs that we have tried to maintain to keep people a little bit connected. And that said, the number of clients that we have reached, contacted, spoken with on a regular basis is close to 700, which during this time is not bad, I feel, honest to God. So just wanted people to know that we have tried to keep them as much in the fold as possible. Now, certainly we've been trying to get our balanced class participants onto Zoom this week, last week. And it just, there's always some wrinkle. So as simple as it is, and here we all are, it's still not, it's just not everybody's cup of tea. And it's just sometimes easier said than done. So we do have our little technical problems trying to get people, and it's laughable really, because I don't know why, but it happens. Winter storm. Okay.
I have something to ask.
All right, Barbara.
Did I miss where you talked about the newsletter?
Yeah, you might.
I did. I said that first. I did.
Okay. Did anybody say how good it was?
It was great.
It was really great. Yeah, I thought much clearer to understand.
Yes.
More interesting. Yeah, I loved it. Just I
I'm
wanted
so
to make
glad.
sure you heard that. Yeah. Okay.
Thank you. Thank you.
Yeah.
I did.
I would second that. I thought that the design was so much spiffier.
I really did.
That's nice. I don't take any credit. Liturgicals, graphic designer worked with us. I think Lisa had some input before she left, and then we just filled it in with our date, with our information. But the format
right.
itself and the
Really good.
color was
Was
done
good.
liturgical.
Yeah.
Yeah,
Very good.
came out
Thank you.
nice.
I'm glad going forward. That'll be fun. The pictures are nice. Lastly, we are trying to put together winter storm resources just because we are always asked for that. And normally we might have a better collection of volunteers to help out, but just in terms of snow shoveling or anything else that people might call us for, we are trying to have that available before we need it. Of course, currently we sort of lack the interaction with the schools and the students, and just in that, they're not as readily accessible as usual, but we'll see. So if anybody does have any resources or recommendations for us that we could put in a list, I would appreciate it. I would take them.
Linda,
Susan?
could I just ask two questions? So one of them is with regard to volunteering, there are a number of people, there are some people in my grief support group, as well as some people in the job seekers group that are really interested in doing volunteering, but they feel somewhat challenged because of COVID. So my question to you is, are there volunteer opportunities that are available to people now, given that we're still in this COVID mix? Is there any volunteering?
I mean, honestly, no, that's challenging for us too. I mean, on the one hand, we have no inside spots for people. I certainly have received some help in a couple of different ways for specific efforts, like the grab and go, the luncheon, we certainly, and right now with the kitchen, I have Maureen Dinsmore helping me.
Yeah, I just thought I would ask.
We'll have more ideas, and certainly as we're looking at staffing the building, so to speak, and I do have a couple of projects that could be, well, I've committed, I guess, to assisting with a couple of town projects and using tax work-off candidates. And if there aren't enough of those applicants or those placements, then I could use general volunteers for that as well. So I will have a great need, but of course it's just uncertain what we can do.
Right, okay.
And then hopefully.
I think as we get, as things start to open up and everybody has a shot in their arm.
Yeah. Well, they did start them this week.
It would be good to have a number of volunteer opportunities readied.
Right.
Sort of outline projects for those people that you know of, Susan, to jump right into.
Yeah. So, I mean, so
yeah, I imagine we'll do a, calling all volunteers and have a list ready for where we know they should go. Yeah.
Okay, that'd be great. That'd be great.
We'll need them, no doubt. I do have actually, that said, you know what, my last item really is that I do have another volunteer talking with the schools and trying to generate some sort of connection with seniors, even remotely with the students, even remotely, just to see. There was just some ideas we were batting around for trying to have a presence to, uplift the students in their particular situation and vice versa for the students to maybe lend some sort of communication to seniors. So I do have a volunteer working on that. So it was a good idea and will probably come to some fruition soon, but it's been off again, on again with the schools is when they've gone remote. So easier said than done also at this time.
So my own grandson has been working with a senior during the remote learning. Now this man does come to the house, but he's got a mask on and he sits at a distance. But this particular grandson needs kind of one-on-one, and man keeps him focused, and it has been phenomenal.
Well, that's nice. So this is somebody that was volunteering to help a student at home with their work?
Yes, he actually is someone we knew, but he was a substitute teacher at the Noah Public Schools.
Nice.
And my grandson's a 4th grader at the Cole School, where he used
That's wonderful.
So I asked him about it because he wasn't paying any attention to the remote learning whatsoever. And then Bill came, and they've had him, ever since.
Yeah.
It's not volunteer, but it's, it's a great thing.
Well, and we didn't get any sort of a formal effort made, but we had a discussion group for many weeks from April through almost maybe into October. And a lot of the people on the discussion group, seniors, were interested in trying to help out the schools, but it just took a more concerted effort than we could give it at the time. So that's great. Very nice.
Okay.
Yep.
In the interest of time, we have a guest tonight, Randy Viraguas from Boston Senior Medicine Community, Education Manager. And Randy, I will let you do your own introduction, please, and tell us about the work you do. Very interesting.
Thank you. Thanks, Janice. Thanks to JD for inviting me. And I have to thank you all for releasing Lisa because I live in Hull. And Lisa's now our director of the Elder Affairs here in town. So I think she's great. I've already met with her and told her all about what I'm about to tell you all. The primary care practice where I work has been around for over 2 years. And they just hired me in November. So I'm reaching out to everybody and telling you what we do because we're not a typical primary care. We're very unique. We only do house calls to seniors.
Wow.
Exciting. Yeah, so I say healthy, sick, or feeling blue, this primary care comes to you.
Wow.
Because it's true. I've worn lots of hats in the senior world. And I know if you usually have somebody coming to your home and insurance is covering it, you have to have a homebound status, which means you're not able to leave. But with primary care, it's different than the VNA. We can come to your home. And so we found a lot of seniors have been neglecting their health or taking care of themselves, been in the home, but not wanting to go to the doctor's office. And we can understand who wants to go to a doctor's office and wait in a germy waiting room only to be whisked to another room, half undressed, wearing a Johnny, waiting another 20 minutes for the doctor to actually come in. And so that's eliminated. We can come right into the home. Wherever the home is, we have patients in assisted livings and, 55 plus communities, independent livings. We even have some on long-term skilled nursing floors. So wherever you are, we can see you. We are actively accepting new patients with Medicare, which is nice. And we'll be taking more insurances in April. There is a, big waiting thing. Everyone's blaming COVID, whatever. And another reason, and I've spent years in assisted livings, and I know a lot of doctors will say, oh, I'll do a house call. Sure, you will. But they're more like a triage nurse. They'll come in and they'll say, sounds like you have gallstones. You're going to need an ultrasound. Why don't you come on down to the lab and we'll do an ultrasound? Or, yes, Betty, it's so nice to see you. We haven't seen you in ages. My goodness, it's time for your annual exam. You're going to have to come down to the clinic and meet with our phlebotomist who'll do some blood draws. We've got to check your, cholesterol levels. We've got a phlebotomist that comes in. We can bring in the x-ray machines. We can bring in the EKGs. We can bring, yes, awesome. Bedside urine tests, which, a lot of people when they age, when they have an infection, it affects all the organs. When we're little and we get a UTI, nobody even knows. But as we age, if we get an infection, no matter where it is, it eventually affects our mind. So you'll see a lot of people acting a little loopy. I used to work on very acute geriatric psych units. So we'd get these calls, my mom's crazy. We're like, hold on. We don't just accept anybody. You have to be medically cleared to come on to a psych unit. Sure enough, usually what happens is they go to the ER and they have a UTI, a urinary tract infection. Guess what? We're not going to take them if they have a urinary tract infection, on the psych unit. And if you had only used Boston Senior Medicine as your primary care, we could have come to the home, avoided all that discombobulation, all the chaos and craziness. We could have said, let's have a little urine sample. Boop, boop, put a little piece of wood and some urine and find out, guess what? You have a UTI, and immediately write a script for some antibiotics. You know, super easy solution. Another thing, just because I know a lot of older people either have a UTI or they have pneumonia. And it's interesting to note, as we get older, we don't always cough when we have pneumonia. So a lot of people will say, well, it's not pneumonia. They have to get a chest x-ray to clear that out to make sure. And oftentimes it is pneumonia, and they go, wow, you weren't even coughing. That's normal. Older people usually don't cough when they have pneumonia.
Know that.
Yeah. So anyway, I think it's very exciting. We're accepting patients from like the east of Massachusetts all the way across to the coast, north and south. So definitely in Scituate. And I'm just thinking you're all probably super excited and have lots of questions. Do you have any questions for me right now?
I do, yeah.
Okay. What are they?
Susan. All right, I'll ask the question.
Sure.
How many doctors, I mean, do you have local doctors around this area ready to come out to?
So, yes, we do have local doctors in the area. I have not met them all. And our medical director is an MD. But I should say what's really cool is the owner of the company. Should talk a little bit about him. He's got an MBA, so he understands business. A lot of people that I've met, I've been like, oh, that's a great idea. And they try to implement it and they don't have the business background, but they have the heart and they have the good reasoning and all that stuff, but it doesn't work out. So I love that he understands business, and he's been doing this for 2 years. Before he hired me, he primed it for growth. So that's good. And he has a doctorate in pharmacology. So his whole concept is, let's look at the patient holistically. Let's look at the whole person and say, hey, what can we do here? We make healthy people stay healthy and sick people get healthy. And how do we do this? Number one, the first thing he does is he looks at the medicines. He thinks, too many seniors are on too many medications. He wants to lower that. And he loves football. So he makes football analogies. He's like, Randy, we're the quarterback. And we've got to make sure that all the players on the team understand what they're doing for the patient. You've got the cardiologist, you've got the radiologist, you've got a podiatrist and a dentist and a blah, 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 and all these specialists. They don't know what the other person's doing. And he said, that's our job. We need to focus on communication, make sure everybody knows what the other person's doing. And so I think we do that well. So far, when I have had the luxury of speaking to somebody that's used us, it's been rave reviews. On my very first day, we got a call from a girlfriend of mine who was working in the VNA world and heard that we do house calls for seniors. And she had just basically kidnapped her grandmother from Maine, who hadn't seen a doctor in 10 years, who was very paranoid and a hoarder. And she said, I could release this information, so I'm not violating any HIPAAs. We're not going to say names, but it's a story she said I could share. And so she said, can you take her? And I said, gosh, I don't know, it's my first day. Hold on, so I called the office. Oh yeah, we can take her. And I said, but when? They were in there the next day. And so I called my friend and I said, how did it go? Tell me the truth, because I need to know. I don't want to work for a company. I've heard good things, but I trust your opinion. And she said, Randy, they were in there for over an hour and a half. She said, the nurse practitioner was giving my grandmother eye contact, making her feel so respected and making my grandmother's wishes known and understood with your practice. And at the same time, she's the healthcare proxy agent looking over and making sure like we're all on the same page here, right? And my girlfriend would be like, And there's just so much that somebody can find from a professional health perspective that gets hidden when somebody goes into the doctor's office. And especially with dementia. So, and especially with medicines. So we can come into the home and we can see all the bras in the microwave and think, Maybe we should order a psych eval, or we can go into the home and see all the zinc and the elderberry and even the green tea and say, whoa, you're on Coumadin? How much green tea are you drinking? You know, and stop things that could be exacerbating behaviors or outcomes and, or, you know, mitigating the results that all these other doctors wanted just from doing a home visit. So I think I answered your question and more. I'm sorry, I kind of forgot where I was going. And I'm staring at the time too. I have to brag, my son is moving out tomorrow morning to Berkeley School of Music. And so it's kind of crazy in my house. And I had asked Linda if I could jump off right when I was done, because we have so much packing to do before we leave tomorrow morning. And
At least he doesn't have to get on an airplane.
Thank
Right.
goodness, right? Yeah.
Susan,
he's an
did
hour
you have a
away.
question?
Yeah.
Well, if she has to go, I mean,
Yeah.
I can.
I
I was
be
just
able to
curious,
answer it.
as you said at the very beginning, that, you know, you said something about even if people are lonely. I mean, in terms of house calls, or is it strictly for medical reasons?
I don't remember saying lonely, but I could have. I said healthy, sick, or feeling blue. And maybe that
Feeling blue, that's what
was the loneliness. Yeah. So we do have a behavioral health component. So we could have somebody come out and do a psych eval. But what we would find is that somebody feeling blue could benefit from some home care. Maybe that's when we'd call JD and say, hey, JD, do you have anybody that would like to hang out with our new patient? They're very lonely, they're healthy, and they'd love to take walks with somebody, but they're a little afraid right now. JD, would you like that patient?
Can I ask, so does that mean this is really, you know, we all have to indicate who our primary care physician is, and that's where this would come in. It was not just a one-off visit when you need someone to come into the home. It is your primary care physician.
Bingo, Linda. We would be the primary care. Yep. And we're very comfortable referring out to VNAs and home care agencies, and we work with all the hospitals in the area. We've had patients that, you know, we got 2 referrals from Milton today, and we got 4 referrals from Encompass the other day. We've got a referral from Mass General. They all work with us. So it's they love that we're doing this. It's like going back in time for them.
It is
You
a
know,
new
saying-
model for sure. Are there any other similar organizations doing this that you know of?
Not as well.
No, I mean, I had not heard of any myself, so.
Right. Honestly,
Oh,
I
it's a
heard
great
there was,
resource. Yeah.
pardon me?
I said it's a great resource.
It is. And honestly, I did hear there is another company that is doing what we do, but they're only doing it in assisted livings. We are willing to go into individual homes. So I think that's huge. It's a big difference. You know, we're not out just for the buck. We're out to really help people. So wherever they live, we'd be happy to help them.
Randy, can I ask one question before you leave?
Sure.
But, you know, need your help.
Okay.
All right.
All right, well, we'll talk tomorrow. I'll try to get on in the beginning of the meeting, Gordon, tomorrow.
Okay, Linda, do you want to go through the building update?
Yes, why don't I? Because I will mention that, not that it shouldn't be significant really, but tonight's planning board meeting, which started at 6:30. First, they're discussing the location of the food pantry in the B wing. And then at about 7 or 7:10, our architect Rachel is just presenting sort of the signage or the lettering on the exterior of the building that needs to be improved by them, approved. So I may want to just jump on that with them. So I just did mention the walkthrough opportunity I am working on for the board, and so I will let you know as soon as we're able to do that. It was sort of the COVID restrictions and the number of people in the building at the same time, but really it's not that feasible right now, but we would love to do that for you even before it's finished. The contractor's work has more or less been extended. It would have been maybe completed the end of this week, but now we're looking at probably mid-February. So there's a delay of that amount, but then also I mentioned the bid had just gone out really for the audio visual work, which is TVs, but also speakers and wiring and security system, hearing assisted device. There's a lot of scope. But anyway, so that's not due back until next week. And then we can't get in front of the Board of Selectmen until February 9th to award a contract. So I'm just saying, then that doesn't even start till maybe mid-February. So that's another delay. Some of the furniture is delayed. Not super significantly yet at this point, but certainly some is. Just a little bit of background for the FFE. So we have in the multipurpose room, the banquet room, so to speak, even though it's dividable, we could fit 160 people if it's at full capacity. So we have 20 round tables ordered that could seat 8. So if we're doing a fundraiser in the future and people are sitting the way we always used to sit, we ordered 160 chairs with arms for that room. Those are a little delayed into March, we believe, but those chairs have arms. And then we ordered another 40 chairs upstairs without arms that would be in the program rooms. And then we're going to mix them. So some chairs will have arms and some will not, just because some appreciate them and some don't need them. So that will be something we need to wait for. Exercise equipment is delivered and pending. Audio visual, I mentioned. Pool table is on order to be shipped March 2nd. IT is something that we're handling in-house. So our IT director is doing that round of purchases. That's, I mentioned in my report, that's not just computer equipment. It's the couple of 3 copiers, I believe, including the veterans. It is the security, also security systems. What else? No, I forget what I said, but anyway, there's a lot in his realm, so to speak. Card access.
Card access.
Yeah, that was a big one. So anyway, that's another piece. But if anyone's gone by, the exterior looks great. The brick looks great. It is that thin brick system, but it's certainly been, not ideal to be doing it in the cold, I guess. But they keep it all covered up, and there's a process for it, but it does look very nice. Also the siding and the walkways, they're doing the walkways around the building as well as the patio and the pergola they were starting this week. Interior does look great. I mean, the painting's done. They were putting in the baseboards and the doors, which has the millwork or the molding around the doors as well. So that made it look very finished. The kitchen installation almost complete. Floors were going in, the fitness floor has gone in, and some of the LVT, they haven't started the carpeting yet. And the bathroom, excuse me, the bathrooms are in process and also look nice. And then next week is the scheduled date to begin the bocce court, if anybody wants to watch that. That's outside. Anyway, so that, oh, and I had it was a nice communication from an Eagle Scout in Scituate that wants to do a project to provide us with a standing wooden herb garden bed somewhere around the building. So certainly we had thoughts of maybe a kitchen garden, and this would be a nice supplement to that for herbs. So we need to just look for a location that isn't too far away from the kitchen, but could be. But anyway, so I said, yeah, that sounds great. Approved that. I guess that's it. Anybody have questions on it though? Anything you're curious about that I haven't mentioned?
You said that there's a kitchen garden?
Well, we've talked about doing that, so not yet.
Yeah.
That would be something once we get in that we would look for a spot for, and hopefully maybe have another volunteer who's willing to make us one of those kitchen beds, raised beds.
Yeah.
Not kitchen bed. I did, we also, well, I had a nice donation today, for instance, from a man who did a wood carving of Lawson Tower, and he came and dropped that off. It was very nice. He did it as part of Paul Cookstis's classes. It was beautiful.
Huh.
We had another one that Town Hall gave us. Somebody did a print of like the longitude, latitude. Can't remember the particulars of it, but it's actually kind of big and heavy. and they wanted us to put it in the senior center. So we have a few things, but there is some wall space for sure for art. And we do hope in the corridors, at least, both upstairs and downstairs, would be a nice spot for rotating exhibits, but there's still plenty of wall space for putting nicer paintings on the walls. We have a few from Joanne Papandrea and John White, who was an artist, who was one of our drivers. But otherwise, we'll take donations, or we were hoping to have a little money left to purchase. And I did have one artist in mind in town. So I already asked her. So we'll see. Anybody has any special requests for art, we can make them.
Does Joe Parsky still do his artwork of Scituate? You know the name?
I don't know if I know that name, but I might not know
He
it.
does. He takes photographs, but he makes them look like paintings, and they're beautiful.
Oh yeah, the digital
Yeah.
painting. Yeah, that's
Yeah.
nice.
Yeah.
I think, yeah, well,
Yeah.
we could certainly touch base with the Art Association or the Front Street Art Gallery, which would be one
Right.
and the same.
All
So
right.
anyway, that's I think I have everything that I might have mentioned about the building.
Yep, you covered, I think, everything. Unfortunately, we've lost a few members. And we lost Laurie and Leslie and.
Oh, Laurie's here, Leslie's here.
Oh,
Oh, you can't see them on your iPad. You can only see 9 people.
that's, okay, so that's my problem.
We're here.
Okay, good,
What?
good.
No, we have almost everybody, really.
Oh, good. So the only thing I wanted to touch on, which we started at the beginning, our bylaws, so our Council on Aging bylaws, we had changed when we updated our bylaws to have our meeting start time at 6:30. And, you know, when we did that, we were not in COVID and people were not in the virtual world. And so I think because we are all home and working virtually, having our meetings at 5:30 has been
Easy enough.
good for everybody. I don't know. But if it's not, tell me. Susan, you raised your hand. I didn't know if you. I can't hear you.
I think I know. I'm trying to stay muted because there's a lot of background noise there to make the audio better for you.
Well, I guess maybe we're wondering if it would be a problem if we went later, or, you know, how do you feel? It was actually almost, if Janice and I went to the Board of Selectmen and they kind of asked us to start later, because even our liaison would have a hard time getting there if she was in Boston. And, you know, so it's tough for working people sometimes to come to a 5 or 5:30 meeting. Not lately, but I guess we feel like at some point we need to go back to it.
Yeah, I think we will, but I mean, I think if everybody is comfortable staying with the 5:30 now while we're virtual, I think that would make sense.
Yeah, because I mean, at least this way, because the meetings, you know, usually are lasting an hour and a half. So this way, at least, yeah, I mean, no one has to travel. At least I think most people aren't traveling. So.
Right.
And Seth didn't say necessarily it was a conflict, but there are more meetings that do start later, and, you know, you can only monitor so many, which is maybe what happened tonight, actually.
Yeah.
I'm not sure why.
Well, I propose that we stay with the 5:30 for now. As things start to get back to normal, we'll revisit this. And
do you need to make a motion?
Yeah, maybe we should have a motion to, you know, temporarily
Stay at the 5:30.
Somebody can make that motion, I guess. Yep.
So I move that we temporarily change our meeting start time to 5:30.
I second the motion.
Very good.
All approved? All approved?
Unanimous? Okay.
Okay. Good. All right. So we will do that. Anything else anybody wants to raise? Any old business, new business? No. Okay. With that,
No, I'm sorry. I will mention one thing that I may not have been very specific about, and then we can call. Sorry, Janice, I don't.
Sure.
So I did mention that I had made a couple of commitments for either using tax work-off volunteers or potentially other volunteers. So when we do open the new building, the planning board had required that we monitor the use of the parking lot and the number of cars coming into and using the parking lot at the senior center. And they had in mind that we would be doing it 5 or 6 days a week, all day. That's a lot of people. And initially, the architect proposed that, yes, they could have the traffic engineer do that. And you can imagine the hourly cost of that, 8 hours a day or more, 6 days a week. So I said, I think we could do that. And I really believe we could. And we'd probably have shifts of 2 people at a time, you know, standing at certain locations for the cars and doing the count and, you know, and then changing shifts. So I'd be estimating how many people I need. But I just wanted to tell you that more specifically, that is something that, I mean, we may not open full on until July, although I hate to think that. And I do hope we're able to have people in the space long before that in April or May, but I'm just not sure. I think their directive was more when we were fully open and functioning at the level that we anticipate, and therefore they want to be sure the parking is adequate for the volume of use. So I just thought that might be worth giving you a little bit more information about.
Why is that?
Why is that from the planning board?
Yes.
That because they didn't believe that we were providing enough parking when we were going before them with all the aspects of the building project. So they were reluctantly approving with some contingencies, and this was one of them.
And what will they do how are they going to determine whether it's adequate or not?
I'm not sure, honestly. And
got some land.
there was a proposal for a future parking lot that would extend the current parking lot that we put in. And that was what may have, you know, swayed someone to say, yes, we'll do that. Now, we could have done that now, actually, but they decided to wait. And honestly, I think the parking will be fine, and recreation and the COA does actually also have to come up with a formal plan. So Maura and I have to come up with a formal plan to coordinate our activities and our events, so that, again, just because they did feel that the amount of parking for both departments and functions and activities was not going to be adequate. So hopefully it will be, and I believe it will be for the short term anyway. And then beyond that, when the B-wing fate is decided, and or the, you know, the soccer field, etc. I mean, things are evolving or will. So we'll see what happens then.
Linda,
We can certainly manage for the first.
you need to coordinate with whom?
Mara, Recreation Department.
Clancy,
Mara Glancing.
Recreation Department.
Sorry, Director for the
And
Recreation
if we can do
Department.
anything to cut down that cost of that study, that'll be great.
Cut down the cost of what?
The parking study. It's gonna.
The parking study, right.
Is easy 6 figures.
It was $183,000 was proposed by the architect with the professionals, you know, doing the counting, which
Oh my God.
which would have come out of the project budget, by the way.
Coming out of the project budget, which means the contingency's down to $30,000 at this
Oh,
point.
we've already exhausted.
So if we
Lee, can you
save
do
that
one of those-
money, now we've got some more money to be able to handle other contingencies.
So again, it'll be on us to provide the manpower. I think that's no problem. I often can't place everybody that wants to be in the tax work-off program. So I think I can do it, but I may need your help, so I'll let you know.
Don't they have those strips that go across the road to just count cars?
Yeah.
I know what you're saying, and maybe we could enlist something like that.
Yeah.
But it's the parking. It's
But
not
it
the
is,
traffic.
it's the parking and how long they're there.
The
Yeah,
car's gonna go out. You just count the cars coming in to the parking spot.
that's
Car
true.
will come in, a car will go out.
Yeah. They may need to know how long the cars are there.
Yeah.
I'll have to go back and look at the proposal, but yeah.
Unbelievable.
Anyway.
Yeah.
So that was just a last.
Yeah, well, I think that's one of those things that once the building opens, that, you know,
We'll find out.
we can do that for a short period, and I think it will turn out to be all right.
Mm.
Okay, I'm going to end the meeting then at 7:04 PM. Thank you all for participating and jumping back on.
I know, good job. Yeah, you're great. Gotta be ready for everything.
Yep.
All right,
Time
nice to
is
see you.
Good night,
Well, if you have any
Bye now.
questions.